Hi, I'm Emily Brown and welcome to the Centre for Health Innovation. I'm in one of our many immersive clinical environments, and these environments are designed to be interchangeable so that we can set them up in all sorts of different configurations. This allows us to have several children's wards. If you hadn't already guessed, I am in the children's ward today, and little Ben and these other patients are waiting for the care of our children's nurses. But tomorrow we could turn all of our clinical immersive spaces into adult environments or theatre environments. And that is one of the key things about the environments that we have designed, is that they can be used standalone, they can be changed, and they can be used to ensure that all of our students get the opportunity to practice simulation within their area of expertise, fully immersing themselves into that environment. This is the largest of our immersive or simmersion suites. And in this environment, we have a 10-foot by 12-foot box. It's basically a big grey box, but what we can do is we can project anything onto these walls. So for our paramedic students, how we have it today, they have come to a scene of a road traffic accident. This car and these patients have been involved. Fire crews are in the background. Our ambulance is ready to whisk these patients off to hospital. As well as changing the sights, I can change the sounds as well as the smells. I could have burning rubber or the smell of engine fire in this room to really immerse the students in the experience. But equally, I can turn up the sound. And in this room, I could make it so loud that you couldn't hear me talking to you. So when we're having to make those critical decisions around a patient's care, how are we going to do that when we can't hear our colleague? How are we going to learn to operate in those environments? That is what an immersive simulation experience will prepare our students to do in practice. I'm here with Sarah in our Simmersive flat, and this is a realistic home environment where our students can come and train and practice what they will actually come across in real life. So today Sarah has been assessed by the paramedics and they're doing her blood pressure in here, and we can interact with Sarah. She's an interactive simulator. She can speak to me, she can respond, and we're able to have that more realistic interaction with our patients. We don't always use simulators or mannequins. Sometimes we'll use actors to play the part of the patients that we're going to look after, dependent on the type of learning that we're looking for with the students at that time. And this sort of environment could be used for any of our courses. As I've said, the paramedics could be in here assessing. Sarah could also be pregnant and potentially being seen by the midwives on a home visit prior to the birth, or potentially after the birth of her child. We could also use this for our mental health students when they're in people's homes, having those important discussions, interactions and episodes of care that happen in a realistic environment. And on those occasions we may use actors instead of simulators. All of these different things being realistic is really important to our students. The suspension of belief and the ability to immerse yourself in an environment where you're really learning what's going on and you've forgotten that you are in university. It is much better and much safer to have this practice, potentially make mistakes, in an environment where we can be supportive and constructive around how we learn from these experiences. As well as our simulation and traditional teaching spaces, we also have lots of flexible spaces for students to study, both in study groups as part of a session or on their own independent work groups, which you can see going on behind me now. Students can use these different spaces to gather and share content, share materials and work together collaboratively. You may even find students working interprofessionally across those different fields that we train, using these spaces to come together, connect and share resources. I'm here in our beautiful open atrium space, and this is really a hub or a centre for students to come to, and it acts in so many different ways. It is a pre-briefing area for our simulation activity. It's a catch up and chat with a coffee area. It's somewhere to come and get a delicious meal from our restaurant. but it can also be used as breakout space or study space for any of our students here, as well as our staff.